Good morning. Welcome to MS There's Hope. This morning we're doing our bi-weekly interview with Dr. Tressa Pinkleton in Seattle, Washington. Good morning, Dr. Tressa.
Good morning, John. Nice to see you.
Good to see you. Today we will be discussing vitamin K. Should we be taking vitamin K? What vitamin K does? And I say should be taking. There's some discrepancy, I guess you'd say, as to whether or not we should take vitamin K, whether or not it would have any effect with us on the protocol. So Dr. Tressa Pinkleton is going to address that today. I'm going to read a little disclaimer and we're going to jump right in here. This interview is from our own personal experiences, and we are not talking in specifics, but in general about our experiences doing the Coimbra Protocol. We are not giving medical advice or addressing an individual case. Cases and results vary using one method or another. Medical protocols and methods of treating MS should be done with a licensed medical professional. Well, again, good morning, Dr. Tressa, and fill us in on vitamin K, would you?
Yeah, so vitamin K is something that comes up a lot in my office when I'm discussing the protocol with people. First, let's talk about what vitamin K is. It is an essential vitamin that helps with a lot of different biochemical processes in our bodies. Helps with clotting, and in terms of the protocol, people bring it up because it can help with bone strength, bone density. It signals to the body to deposit calcium in the skeleton. So you can see why people on the Coimbra Protocol are focusing on that nutrient, right? Vitamin K has, other than taking a supplement for it, it comes from two different places primarily. Foods we eat, dark leafy greens, and fermented foods. And then also our own microbiome, the beneficial bacteria in our colon also create vitamin K for us. So that's where we get it without supplementing. And it's one of the reasons why I tell my patients on the protocol, listen, eat your dark leafy greens. Don't be afraid of them because they're rich in calcium. Just don't turn them into a beverage, but eat them. You want vitamin K in your body, right? Dr. Coimbra originally had vitamin K as part of the protocol to help ward off osteoporosis. And he also had concerns about calcium deposits in the arteries. What he noticed over time was the people that didn't really take the vitamin K, so long as they followed the diet and the exercise requirements, so low calcium diet and weight-bearing exercise, or what I like to really push people towards, strength training exercise. So long as they did that, the vitamin K didn't really offer them any extra benefit. So he removed it, not because it's bad or people shouldn't take it, but because he didn't find it absolutely necessary. And because the protocol has so many other nutrients one needs to take and has a cost to it already, he took it out, since he didn't want to put undue pressure or financial burden on his patients. And I totally understand that. So in my office, that's what I counsel. I tell people, if you're worried about osteoporosis, you need to strength train. Like, there's no amount of vitamin K that you can take that's going to prevent the bone loss from this protocol if you're not strength training. And I have found that people doing the strength training, I've even had DEXA scores improve, seeing bone density improve over time without any vitamin K supplementation. And in terms of the calcium deposits in the arteries, or people have worried about soft tissue deposits, I tell them, if you're following a low calcium diet, you're not going to get that excessive calcium deposition in your body, because those things happen with hypercalcemia. And we get hypercalcemia on the protocol from either eating too much calcium or eating too little. And that's another conversation you and I should have maybe next time, because eating too little calcium can also cause a transient hypercalcemia. But provided those things aren't happening, one shouldn't really need vitamin K supplementation if they're having their vegetables, which again, I push in my office all the time. There are a few cases where I will prescribe vitamin K. I have some patients that have osteoporosis and they're on the protocol. And so they take vitamin K as well as some other nutrients to help reverse bone loss. And they seem to be doing well on that. You know, we've got a couple of DEXA rechecks coming up on my schedule for them. So it can be appropriate, but in general, for every single person on the protocol, I agree with Dr. Coimbra that it's not 100% necessary.
That's interesting, because I would say, after doing this 4 years and 4 months and 12 days or 7 days, who's counting? I would say that one of the biggest questions that we see, and I just saw it the other day, is vitamin K.
Yeah.
And one thing that I want to put out there with everybody is that everybody wants to think that there's like a missing link, that there is something missing. And what I personally witnessed, now this is just my own personal experience, vitamin D is the key, and then the rest of the things help vitamin, they're necessary, but the vitamin D is something you need to pay attention to probably more than vitamin K. Would you agree with that?
Yeah, I would agree with that. And I do think one of the reasons why people focus on vitamin K, other than hearing those two vitamins, talked about together a lot, but there is a gentleman who wrote a book on the protocol, and he took several protocols and wrote about them together, and one of those was a vitamin K protocol. And I think people find that book through Amazon and read it. And because most of the time when I have a new Coimbra Protocol patient and I ask and they're focusing on vitamin K a lot, I'll ask, where did you learn about the protocol? What research have you done? And that book 9 times out of 10 is referenced. I really do think that that's a reason why I'm seeing more focus on vitamin K, is because that book is being read more and more. That book has a lot of misinformation. I don't know if it's because of the translation. It was, I think it's Amazon published, and you can just have it translated from whatever mother tongue.
I want to interject something there. There are a lot of books on Amazon now, and people there's an old saying, don't believe everything you read. I know some of the people that are having things published on Amazon, and they're selling a lot of books, and they're fake. They're not real at all.
I want to give this gentleman the benefit of the doubt. I purchased the book and started to read through it, and when the bio says that his mother went through the protocol and he was so inspired he wanted to write this book, and some of the biochemistry is backwards, and I don't know if it's because it was mistranslated, or if this gentleman, who does not have a scientific background in any way, shape, or form, just doesn't understand. But there's a lot of vitamin K discussed in that book, and I think that's a big reason why people bring it up more and more. Because when I first started doing this protocol with people, I didn't hear a lot about vitamin K in my office, and just about every new patient I have now asks me about it. So.
Yeah, it's really, I see it a lot more over the last 2 years, I guess, probably being discussed, and people, it's kind of like I said, there people are looking for that missing link. I know what it's like when you have MS. You want to find something that kickstarts you, or something that stops the disease. And for me, when I was doing the vitamin D, I just knew it was just obvious to me.
Yeah. Well, I think that's a good, that wanting to find the missing piece. I totally understand that, and I think that
Sure.
This is another one of the reasons why it's so important to work with a protocol doctor, because we have the medical training to understand the science behind the protocol. And we, worked with Dr. Coimbra and, learned directly from him to understand how this protocol affects people. Whereas doing it on your own or reading a book written by somebody that's not a protocol doctor, a lot can get lost in translation or misunderstood.
And there's something I want to say. Yes, doctors can be wrong. I mean, Anna Claudia points out in her book that ship's doctors knew that a tablespoon, I think, of citrus oil would help deter scurvy, but it took the medical community 300 years to get a grasp on that. I understand that, but usually on a lot of things, they've studied the human body and they know, which is leading me to something else. And I tell people, I've said this over and over and over again, and I'll say it till I'm dead. Don't go on Facebook and YouTube and get all your medical information.
Yeah.
People, you don't know who's giving you medical information. I can't say that more clearly. Somebody can say something and seem very professional, and the whole time he's writing it, he's sitting in his underwear at his kitchen table, feeding one of his 400 cats.
Hey, don't knock the cat people.
I said 400 though, not 400. And I don't get me wrong, I love cats, but he could be sitting there eating Twinkies and telling you something, and you're like, oh, well, this guy seems very smart. Just, when I started this, I researched it. And what irritates me probably more than anything is people doing their health and doing something very important, and they don't research. People, the information is out there. You just got to research, and not be lazy.
Yeah, I mean, yes, I agree. I wouldn't use the term lazy, and I try to give people the benefit of the doubt, the health components that go on YouTube. But for the most part, I think it's important, or imperative rather, while on this protocol, to work with a doctor trained in it, because of the damage it can cause if you're not doing everything as you should. Yeah. And then also to not have you taking more than what you need. I mean, I have patients come to me and they're taking lots of extra vitamin K and extra this and extra that. And through working with me, we're able to whittle down their supplement schedule. And not only am I saving them money, but I'm also just saving them like mental bandwidth around taking stuff and lessening the chance of what I call pill fatigue, But, that being said, again, sometimes vitamin K is appropriate for some. Some people don't have the microbiome to create their own vitamin K, or they don't get enough of it dietarily. And so I will suggest some vitamin K supplementation at that time, but it's not 100% necessary for everybody. And understanding that nuance, I think, can be or is important. Yeah.
So you believe that the body will absorb the vitamin K even with taking all the D and all the other supplements?
Yeah, because if not, I would see issues pointing towards vitamin K deficiency with anybody that was on this protocol, and I don't. I've seen it in a few, and we've given vitamin K and they've self-corrected. But across the board, most people do just fine not taking vitamin K, in my experience.
Yeah, I mean, there's a lot of things that we can do. I know people that don't take vitamin B at all, and they're fine. And so that's one thing that, there's just stuff out there that some people they need desperately. And some people, it doesn't make any difference.
Yeah, so, no, it's true. And I think a lot of that has to do with genetics and with diet and with gut health. A lot of that has to do with those three things. So
is that everything you have to say about vitamin K too?
That's all I got for today.
Oh, all right. I guess our next meeting in 2 weeks, what was you said? I'd like it, by the way, when you come up with a topic. That makes it easy on me.
I'd like to talk about calcium regulation and the low but not no calcium diet. A lot of people get that confused. So I'd like to speak about that next time.
Yes, definitely. Um, because I see that more and more too, where people are like, well, I can't, what's the recommended daily allowance and all
Mhm.
that kind of stuff. And that's a question that we get a lot.
Yeah.
So
Well, we'll talk
we'll
about that
try.
next time.